Now into Module 6 and our last of various techniques that we use for assessment, or at least the broad categories of that. And that's personality tests or self-report inventories. The two kind of coexist in many ways. And so the first one is we're going to talk about is personality tests. And what you see here is data is going to be collected from a standardized setting, usually some sort of clinic setting. And what you're looking at here are underlying traits or abilities are going to be assessed. And these personality inventories, the objective tests, contain very clear statements that a person endorses or rejects. In other words, true or false as it relates to yourself. Now, there's two of them there, the MMPI, which I'll talk about in the next slide, and there's the personality assessment inventory for adolescents, just a couple of them. But the granddaddy of them, and the one that's probably best known, is the Minnesota Multiphasic Personality Inventory, otherwise known as the MMPI, and there is the MMPI-2, most widely used of all the personality inventories here. And in 1989, they did a restandardization of the 567 true-false items. Yes, you're reading that correctly. So if you thought our tests in this class were very lengthy, you can only imagine. Now, the good news is there are no wrong or right answers in regards to this. And so it only takes 60 to 90 minutes, sometimes 2 hours, depends on the level of processing for these individuals. And these are usually just administered to adults, the MMPI. There's some debate about personality and when it sets in children and adolescents. There is an adolescent one called the MMPI-A, which stands for adolescence. But it looks for personality patterns, and it's based on this kind of actuarial interpretation, which analyzes the results of the specific test on the basis of very set rules derived from the empirical research. So we know from enough of these profiles, as you kind of crunch them through the numbers, and the computers kind of spit back how these may group together. So it is a much more specific process than you might imagine. You can't make a diagnosis solely based on the MMPI-2 profile. So it's going to be a part, just like any of these other areas. So you're going to have interviews, going to have observations, going to use some of the like personality inventories. You may even do some more psychological or psychoed testing, so like achievement skills or intelligence levels, things like that. But this is certainly a big part of it for those especially who have fairly severe kind of either personality issues suspected or more severe psychopathology. Now, the MMPI also has a variety of what we call validity scales. And the validity scales is really just trying to see whether a person is not trying to be truthful in their answers, or they're overly defensive, they're careless, in other words, they don't respond in the same way to very similar items, if they're conflating their particular issues. So, for example, individuals who really want to get certain medications, and in order to do so, they have to have a diagnosis. So they kind of fake the symptoms so that they can hopefully game the system and get the drugs that they're looking for. Something like the MMPI-2 could easily spot a lot of those individuals. So let's take, for example, the lie scale there. This is where a client is faking good. And so what the lie scale is it's sensitive to very unsophisticated kind of attempts to avoid answering in a frank and honest manner. You have the F scale. This is where you're faking bad, but only faking bad in the first half. Then you have a kind of a correction scale where people are denying symptoms. And you can see the variable response inconsistency and true response inconsistency. So it's not only how you're answering, you could be answering very consistently, but maybe consistently towards where you want to look bad, and this would pick up on that. So all of the scales, even the behavior rating scales that I talked about these days, tend to have some of these built in, but the MMPI-2 by far has the most. Now, there are clinical scales in addition to the validity scales. And so this is an example of the clinical scales that you're seeing on the MMPI-2. There are 10 of them, and you can see some of these scale scores are more important than the evaluation of any particular scale. In other words, we're looking for patterns and not just an individual score. And you can see hypochondriasis, which is just being overly concerned with body concerns, some psychosomatic kind of things, depression, hysteria. So this is kind of, you can see traced to sort of physical symptoms that are more mental or medical related. Psychopathic deviant. A lot of people are very interested in this. I know because, we have people that watch too much Criminal Minds and other sorts of things, which are very interesting, but you don't want a lot of psychopathic deviants out there. Many of them, not surprisingly, end up in prison. Masculinity and femininity, paranoia, psychasthenia, which is more the anxious, worried aspect, schizophrenia with your disturbed thinking, hypomania, and then social introversion. So those are all the details. It's interesting how they came up with the MMPI versus a lot of the other personality inventories, which were more theory driven. The MMPI originally started out by talking to people who were in inpatient institutions for mental health issues and just ask them various questions on how they perceive things and then base their questions off of that. So a little bit different than some of these others, but it's the one that stuck and is probably the best known of all of those. So that is a personality inventory. And like I said, the best known one, but there are many others out there. Next, what we're going to talk about are projectives, okay? And what projectives are is people are presented a fairly kind of generic or ambiguous stimuli, and then they're asked to comment about it, okay? So the best known of those, the reason I have that man up there, Herman Rorschach, is the Rorschach ink blot test. And even if you didn't know the name of it, I am sure you've seen plays of it in various media and other things because it's quite famous. You can see it was developed way back in 1921, consists of 10 ink blots, and those people's interpretations are used to assess personality characteristics and psychopathology. It goes much more into that Freudian kind of unconscious way of assessment rather than the more empirical, validated, behavioral kind of approach that you see in the personality inventory, but also some of the various observational techniques that we discussed back in Module 5. So with the Rorschach ink blot, now half of them are on gray and white backgrounds, like you're seeing right here, and then the other 5 have big splashes of color and stuff. People are presented with this stimuli and asked to generate a response. So give me a story, give me a description. There's some other ones like the thematic apperception test where it's not ink blots, but it's more just a generic situation with individuals. And then you have to have a story about what happened before and then in the middle where the picture is and then after. And so it's really asking them to have to go further in their descriptions. Now, initially, the way that they evaluated the Rorschach is that they looked for these kind of broad themes that may describe some sort of hidden desires or conflicts these people have, and it's based on the way that they tell their stories. You're looking for these kind of themes. It assumes that the responses are going to contain some sort of clinical information, the hidden desires or conflicts that come out, almost like what we talk about with Freud and his technique of just projection, free association that we talked about earlier in our treatment chapter, where you just talk about general things. It is, like I said, based on psychoanalytic theory. The intuitive scoring is, are there themes like of anger or guilt? And then John Exner, the man on the upper left-hand corner there, he created a more objective quantitative scoring system for the Rorschach and looked at the form of responses rather than the content. And that's probably, if anybody gives a Rorschach, that's generally how it's going to be interpreted, is through the Exner system. That being said, one of the big problems with projectives that we'll talk about, but is that it's just not very uh, reliable. In other words, it doesn't have the same results consistently time after time. It depends a lot on who the clinicians are, and even with the Exner system, the conclusions may vary quite a bit, which is not exactly what you're looking for if you're trying to come up with a definitive diagnosis. That being said, it can still have and contribute a part to an overall diagnosis. So you still see those in certain areas. As I was mentioning before, the thematic apperception test. So you can see an example of a man giving a woman that, and you can see the picture. So kind of ambiguous situation, not sure what's going on, but you can go all sorts of ways with that. You could be, like, oh, it's an old woman worried about their daughter's outcome, or it could be an evil witch who's telling Snow White evil things to do, and that's kind of the interest in how people perceive this. Now, these aren't the only projectives, by the way, just like those rating scales and other things we went over in the previous module are not the only ones, but they do hopefully give you an idea of what those techniques are going to look like. So, as we have for the last observations and interviews, what are some of the advantages and disadvantages of these particular approaches? Well, the personality inventories, projectives, they can provide useful information that there really is no other way of gathering by other methods. Maybe somebody's so defensive, it's just hard to get another insight. It can reveal a person's worldview, maybe some of their unconscious motives, so that can be helpful and can be supplementary to a lot of this other stuff that we learn in the assessment measures. Times I've used any of these, it usually is as a supplemental kind of method. As far as limitations, as I was saying, the reliability and validity, is this really measuring what we want it to measure? Is it being measured consistently? That's always a concern. Not really a lot of standardization in scoring and administration. More for the projectives is where that's a limitation. There's pretty standard ways for the personality inventories when you're looking at that. There's not a lot of norm data associated with these. So when we talk about things like intelligence tests, there's lots of what we call norms, meaning we've tested on a lot of people and we know what typical responses are for typical age ranges. And we don't really see that with these more projective kind of techniques. And then finally, it can be very time consuming. You have to write down all the responses of the individual for each of the 10 different, if you're using Rorschach, or maybe even more with the TAT, the thematic apperception test. So that's another concern. So hopefully this brings us into the module, and you've got a good idea of both how we classify disorders using something like the DSM-5 and how that's organized. And then how do we actually do assessments to be able to give those classifications using either interviews, observations, or some self-report type of inventories or projectives. And we take all those together, hopefully we come up with the right type of diagnosis. And that's the sort of stuff that we'll be talking for the rest of the semester. So that's going to end chapter 4 here. Stay tuned for chapter 5 coming up all too shortly.